Thank you again for joining us. My name is Bryce. My pronouns are he, him, and I will be guiding everyone through our session tonight. To begin, I'd like to say a few important words. As a treaty person, I'm grateful to be able to live, work, and play on this land. Western's campus is located on the traditional lands of the Anishinaabeg, Haudenosaunee, Lenape, and Chinongton nations. These lands are connected to the London Township and Sombra Treaties of 1796 and the Dish with One Spoon Covenant Wampum. Thank you very much for being here tonight. Today, I'm joined by my co-host Chris, a number of staff, faculty, and current students from the Arthur Labatt Family School of Nursing. And of course, all of you, welcome. Let's go through a few housekeeping items before we get going. Firstly, this session is being recorded. It will be available on our website in about a week. You'll be able to find it on the same page you went to for registration, welcome.uwo.ca/presentations. Next, live closed captioning is enabled. If you'd like to turn it on, you'll find the live transcript button on the bottom bar. Then you can choose show subtitle or view full transcript. Just remember, this is live closed captioning, so we can't guarantee the accuracy. Next, your video and audio will remain off today, but that doesn't mean we won't be interacting together. We'll have polls throughout the presentation, and we also want to answer all of your questions. You can submit a question using the Q&A box, which you'll find at the bottom of your screen. You can enter questions now or anytime throughout the presentation. Someone from Western will type an answer to you, and we'll also answer a few questions live at the end of the presentation. One tip about questions, be as specific as possible to get the best answer. So let's get started with a poll right now. If I can have my colleague Chris launch the poll, we'd love to know where you're joining us from today. All right, we've got a few folks joining us from London, Ontario, elsewhere in Ontario, and elsewhere in the world. Fantastic. All right, and we'd also love to know, are you joining us by yourself? Are you joining us with some friends, some family members, maybe a sibling? Or are you flying solo this evening? Awesome. All right, well, wherever you're joining us from, whoever you're joining us with, we're so happy you're here, and we want to fill you in on our schedule for the night. So this is our itinerary for this evening. We're going to start with a welcome from Amy Horton, the Associate Director of Undergraduate Nursing Programs. Then lecturer Jessica Timbrell is going to help you understand what it's really like in nursing, things like what courses you could take and the experiences you could have. Next up is a mini lecture with Amy Horton. This is a sample from a course on clinical judgment. After that, we're going to get to know some current nursing students in a student panel. They will share some of their personal experiences here at Western. And finally, we'll all join together at the end to answer some questions live. We hope you'll join us for the entire event, but if you can't, no worries. As I mentioned earlier, there will be a recording available on our website. And don't forget to sign up for our other events. We have lots of other events coming up this spring. If you haven't attended a Next Steps presentation, we highly recommend you do so. It's helpful for everyone to understand what to do before coming to Western. We actually have one set up for tomorrow evening. We also have a special presentation about residence if you're thinking about living in residence or you just want some more information. And last but certainly not least, a presentation from student experience. You can find them all on our website, the same place you signed up for this event, welcome.uwo.ca/presentations. Without further ado, let's get started. I will now invite Amy Horton, Associate Director of Undergraduate Nursing Programs, to say a few words to welcome you. Take it away, Amy.
Thanks very much, Bryce. Hello, everyone. My name is Amy Horton. I am the Associate Director of the Undergraduate Programs here at Western University. And on behalf of myself and the Director of the School of Nursing, Dr. Victoria Smyth, I'd like to welcome you to the event tonight. And I'm so glad that you're here to spend some time with us. You are really considering entering the profession of nursing at a very exciting time. but also a crucial time in healthcare. If COVID has shown us anything, it is that nursing is one of the pillars in the care of individuals, families, and communities. And without skilled nurses, the healthcare system would really suffer. I think you know that, and I think that's why you're here. But I'd like to give you a little bit of my experience at Western as a student. I have grown up at Western and can honestly say that I bleed purple. I was drawn to the university at your time of life because of the vibrant campus life, the sense of community, but also the scholarly activity that the School of Nursing provides. And I think I won't tell you how long it's been since I've graduated, but over that time, all three of those things have really increased at Western University. And because of that, I have come back for 2 more degrees specifically at Western and have dedicated my professional life to this program. So I do hope that inspires you, and I do hope that you enjoy the evening, and I look forward to answering any questions that you may have over the course of the night. Thanks again.
Thank you very much, Amy. We're going to get right into our next presentation with lecturer Jessica Timbrell, who will be going over what nursing is like at Western. Thanks, Jessica.
Okay. Hi, everybody. My name is Jessica Timbrell, and I'm going to share my screen with you. Hang on a minute here, if I can figure it out. We can't. Denise, how it was working before.
Just hit your share screen, Jessica.
I am, but I'm trying to get the presentation up. Hang on a minute. Oh, there it is. Hang on. Here we go. There. Hopefully everybody can see that. Sorry about that. It always works in rehearsal, never on stage. Okay, so this is just a brief kind of overview of the programs, the undergraduate programs that we have at the Arthur Labatt Family School of Nursing. I'm Jessica. My name's at the top there. I've already introduced myself, and you've heard from Amy Horton. But Denise Litzen and Michelle Wagler are crucial members of the team here at the School of Nursing because they're your academic counselors. And so they'll make themselves known to you right from the beginning, and it's in your best interest to know them because they offer a lot of different types of support for students as you progress through the program. Denise was so Amy won't tell you how long ago it was since she graduated, but I will. It was 20 years ago, I know. And Denise was our academic counselor back then, and she knows all. And so there's really a very experienced and supportive team here to support you as you progress through your chosen program here at Western. And when I say chosen program, I say that because we have 2. I suspect that the majority of you are watching this presentation are either interested in or considering, or are perhaps have already accepted an offer to our collaborative nursing program. We're in collaboration with Fanshawe College for our 4-year nursing program. But we also have another program, and it's our compressed time frame program. And there may be some of you who are interested in that one too. And even if you're interested in the collaborative program, it's worth knowing that the CTF, as we call it, program exists. And we'll talk about that a tiny bit more a little bit later on. But the majority of our talk today will be about the Western Fanshawe Collaborative BSCN program and what that means. So here's a pictorial, I guess, depiction of what that means to be a collaborative program. So essentially, and most simply, it's just Western and Fanshawe are joining together to offer you your nursing education, and your degree in the end when you graduate is from Western University. So the first 2 years of the undergraduate, the collaborative program, are spent at either the Western or the Fanshawe campus. So if you've applied to our program, you'll know that that was two separate choices when you were applying to different programs wherever you applied, because you can either begin at Western or you can begin at Fanshawe. You don't bounce back and forth for those first couple of years. You're at your designated campus, but for the last 2 years, for years 3 and 4, everybody comes together, and they come together at Western's campus, and they finish their last 2 years, all students together, and graduate together from Western. So as you can see in this little box here, regardless of where you start, you're always a Western student. And that has implications for, things like amenities and sports and that sort of thing. Okay, and you can see over here too in the numbers that 144 students are accepted into the Western site every fall, and 128 students at Fanshawe. And if you can kind of think ahead, that makes that year 3 cohort very large when everybody comes together over from over at Western's campus from Fanshawe. Okay, so next couple of slides are just going to take you a little bit through what the years look like at Western, so in the collaborative program. So year 1 is, and you can probably tell from the names of some of those courses there, year 1 is really about your foundation. So the foundations of nursing, so that we have something to build on as you move through the program. And not even just years, like even the terms. So from term 1 to term 2 of each year, these foundations are laid in the very beginning so that we can keep building on those things as you progress forward. So for example, in term 1, you're going to take courses such as the foundational concepts of nursing. You're going to be talking about theory, you're going to be talking about origins, health promotion and caring, self, colleagues, and clients. This is about starting to think about relationships differently. The relationships you have with your patients are not the same as the relationships you have with your friends or with your family members. They're therapeutic relationships, which involves different kinds of interactions and communications, and you need to learn what that means. And so a lot of your first year is based on that kind of foundational stuff. Holistic health assessment is a course that holistic health assessment 1 and 2. So it kind of spans, they're 2 separate courses, but it spans both terms. And essentially it's your health assessment of a human being, so body systems, but also other things that nurses assess. So yes, nurses assess hearts and lungs and abdomens and brains, and right, we assess these things, but we assess other things too. We assess things like, what kinds of things are clients at risk for, and so what kinds of interventions could be planned that might mitigate those risks. Or we screen patients for things like, violence and marginalization, and these are the kinds of things that nurses assess, right? It's not just about body systems, and that's why we call it holistic health assessment. This is foundational stuff. That's why it's happening in first year. You take human anatomy in first year, which helps all that physical assessment make more sense. And you also take human physiology, and that one goes across the entire year. So both terms 1 and 2. Some additional opportunities later on in the program. We have something called AY4, or it's Accelerated Year 4. And what that is it's there's spaces for 120 students to basically forego your summer after 3rd year finishes and just launch right into starting 4th year right away. Skip the summer, start your 4th year, and then you graduate in December rather than the following spring. It's not for everyone. This is not for all students. Lots of students need their summer for lots of reasons, for their mental health, because they need a break, because they need to work, because they have a family, right? But for some students, this is really attractive. So if this interests you, Denise comes and makes a whole presentation about this when the time comes for you to start thinking about it. And it's a possibility to just keep in the back of your mind. This is a possibility for you to kind of accelerate that end part of your program. We have international placements. We have had to put our Rwanda placement on hold since COVID started, obviously, but we're hoping to get that back up and going as usual again as soon as possible. It's an opportunity for students to go, usually for the month of May, to Rwanda. It's in third year, and Denise will correct me if I'm wrong about that. It's in third year, and it's a small group of students, and they go and they work. It's in pediatrics, and they get an elective credit for that. So that's also something that's not for everyone, right? But it's really attractive for some other students. So these are just some interesting kind of unique opportunities in our program that you can be thinking about. Okay, admissions. This is usually something that if you are just sort of contemplating nursing, coming to Western, just scoping out your options, this is something that's of great interest to a lot of students. What is it? What do I need to get in to the program? Something we introduced a couple of years ago is called the CASPER assessment. CASPER, that's what it stands for there. It's a long kind of acronym there that is basically assessing your non-cognitive skills. So it's getting away from just a strictly grades-based admission basis to something that involves a little bit more about the student and their empathy and their compassion and their sense of ethics and their, so it's a way of kind of looking at some of those qualities, that we know make really good nurses, but we don't know that those qualities are there if all I'm looking at is the student's grades. So we're pretty excited about the introduction of CASPER, but there's still the grades talk. So here's what you need to get into the program. You need to have a minimum of 65% in each of 12U, English, biology, and chemistry. You need that grade 11 math, but all you need is a 65 in that. We're not looking for how high your mark was. We're just looking that you passed your grade 11 math. If you're really good at math and you want to involve your good math mark in your average, your entrance average, that's perfectly fine. But if you're wondering about the purpose of that grade 11 math bullet being there, that's all that's there for, because that's all we're looking at. Okay. More information, if you're interested in more specific information about admission requirements, etc., that's the link that you can access down there, and you can find out more information about admissions. Offers of admission, they're all conditional. They're all conditional on successful completion of anything that was a prerequisite course for you. They're all conditional on maintenance of that minimum average that's there outlined for you in an offer of admission. And that the deadline is hard, and it's important that you know that. There is no wiggle room on that deadline. That's a hard deadline, so you want to meet that. There's 3 rounds of offers, and the largest round is in May. So there's always people listening to this kind of presentation who are waiting, and their friends are starting to get their acceptance letters to various places and they've not received anything yet. Please don't panic. Our largest round of offers goes out in May. So there's still plenty of time for these offers to come rolling in. So just a little bit of reassurance there. Okay. Residence is guaranteed to all first-year students, and I think probably most of you who are interested in residence already know that. You need to accept your residence offer by the deadline. Again, these deadlines are hard. And then after that, and you've paid and all of that, you'll receive a confirmation email that tells you how to access the portal to access some more information and some more placement related information, like placement within your residence. So but if you didn't know, residence is guaranteed for all first-year students. There's a lot of scholarships and bursaries offered by the university, and scholarships offered within the School of Nursing. And a lot of students assume that somehow that they're probably not qualified. I'm probably not qualified. There's nothing I can apply for. Read these things, read these scholarships and bursaries, read these outlines, and and access some of these things that are there for you as students, but sometimes don't get accessed because, I don't know, there's lots of reasons, but sometimes it's because students just assume they're not qualified. Look into these things because there's money to be had and money ready to be, you know, given to students to support their education. So consider going through and looking through some of these things that are on offer for you. I said I'd mention a little more about the compressed time frame program. So if you're interested in that, or, you know, sometimes it's even worth knowing for those of you who are coming to or interested in the collaborative program, it's worth knowing that, you know, maybe you're thinking, maybe I don't know where to start. Maybe I don't know if I want to start in nursing. Maybe I want to start in health sciences or something like that. But then what happens? Then, you know, do I have to do a whole 4 more years, you know, if I change my mind and want to come back? Sometimes um, you know, there's that sort of place for a program like this. This compressed time frame program is a second entry program, so it is not a direct entry from high school program. To get into this one, you need at least 10 university level credits. And truth be told, most students, not all, but most students who come to this program already have a degree, and some of them have more than one. Some of them have several undergrad, graduate degrees, PhDs. All kinds of students come to this program. It's a very attractive program for certain types of students. It's very compressed, hence the name, but so compressed, it's 19 months long. It's the shortest in the province, and there's lots of compressed programs in this province, but this one's the shortest, which is very appealing for some students who want to just keep their head down and, you know, work the program and get out there and start working. And for other students, it's not a good fit. But it exists. So if you're interested in the compressed time frame program, Michelle Wagler is the academic counselor for the compressed time frame students, and can help you access more information if you're interested. But how it works basically is it's 5 consecutive terms instead of taking a summer break at the end of each year. So first year for the collaborative students is actually 1 semester. For the compressed time frame students, it's highly compressed. There's certain prerequisites, but everybody comes out with the same Bachelor of Science in Nursing degree at the end. So that I mentioned this already, the university credits. Casper is still a component of this one. And there are prerequisites, which a lot of students already have because of their other education that they've already done, or they work away at these prerequisites, you know, online, and find ways to get them under their belt so that they can be ready to apply to the compressed time frame program. Okay, the compressed time frame RPN to BSCN pathway, we're really excited about this. We're calling it a pathway. It's a pathway. It's not a separate program. It's a pathway for registered practical nurses, or even PN students who have just finished the practical nursing program, but are thinking to themselves, you know, I really would like to have my BSCN. It's designed for these folks. So they must have a minimum of 5 university credits, but their pathway goes through the compressed time frame program that already exists. So some modifications are made to accommodate the education that these nurses already have, and some other things, but it's a way to sort of expedite that travel through that program and end up with the BSCN in the end, and it honors the knowledge and education and so on that these nurses already have. So we're pretty excited about that one. If you can see down here in the program highlights, also 5 consecutive terms. There is some funding that is available for students. You must work the program full-time. There's no part-time registration offered. And the enrollment in the pathway is limited at this time. But you know, the hope is that down the road that opens up to serve more and more students in the future. Admissions, much the same as our other programs. We involve the Casper assessment, but then some more detailed admissions related information can be found here at this link, because we're talking about people who already have credentials and certain prior education in the field, and there needs to be credit given for that, right? So if you want to know any more details about that, you can access those details at that link. These are some photographs from our actually, so these are from one of our labs and our simulation suite. So we've got lots of different hands-on environments that students work in for their labs, for their simulation courses, depending on what it is that they need to learn, that particular course or that particular class. In our simulation suite, it's brand new. It's in our brand new building there. It takes up a very large portion of just part of the first floor there. And it's set up like a hospital, and it has 4 pods. There's 4 beds in each pod, kind of like a ward room, if you've ever been in a hospital and know what those look like. And so we can have small groups, which is preferred for that type of learning. We prefer it. But we can also have different things happening simultaneously, because the pods are kind of separate from one another, or separate enough to be able to do that. We use mannequins, as you can see up here in the upper left. We use standardized patients, which are medical actors that we hire out of the program that runs from the Schulich School of Medicine, and that's fantastic. The lab that you can see down on these bottom photographs here are from a different lab. This is these all real hospital beds. These are places where, for example, in the first year, where you might learn about your physical assessment skills. So I talked about how in your holistic health assessment class, you'd be learning about body systems and how to assess different things. You would do that here. You would work with a partner, and sometimes we use case scenarios. Sometimes you kind of just isolate the skill and work on that. Simulation tends to be where the context part comes in. But standardized patients work in the lab as well. We use them for the lab, we use them for simulation. There's some really interesting and exciting kind of innovative stuff that comes out of these environments, and you'll be able to read more about that on our website if you're interested in that sort of thing. Here's some students working with some patients. Some of the highlights of working in simulation specifically. It's not all nursing schools generally have labs. Not all schools necessarily have simulated learning or simulation environment. So in this particular environment, we know simulation works, right? We already know that. There's lots of literature to talk about that it works, and that it can, support, and even in some cases replace, actual clinical practice opportunities. The reasons that we like to use it are numerous. So we keep our groups very small in this environment, in the simulation environment, usually 6 students to 1 clinical instructor in a pod that I was mentioning before. So the advantages there are that you get a lot of one-on-one attention. You get attention in the moment, right, from your instructor, who is right there. I've taught in here for years, and I'm right there. I'm not standing back making notes on my clipboard. I'm in there with the students, and we're learning about how to care for these patients. Sometimes I pretend to be the staff nurse if I'm offering my help. Sometimes I pause and say, "Whoop, let's hang on one second. How do you feel about what you just said?" So that's another advantage. We can pause in the middle of what we're doing and talk about it, and we can even back up and say, "Do you want to just try that again? Enter the room and just try that one more time, and say this different thing and see what happens when you do that." That's not something that you can do generally in real life, caring for patients, and so that's a great advantage for us. The in the moment feedback, the modeling that the instructor can do. I can say to students, let me show you something, and maybe I have an interaction with the patient, and I show them what that conversation could have looked like, maybe a conversation they were having trouble with. It's safe, it's controlled and designed in here. Right, this is the place to practice. We practice with patients, live clients. We practice with patients, but we don't practice on them. Right? That's for the lab and for simulation. That's where we can practice on people and mannequins and so on, so that we're good and prepared when we go out into actual clinical practice and practice with our clients. So yeah, and I could go on and on, but you can see some of the other bullets that are there. It's usually a course that students are nervous to start and are so grateful for when they're finished. They always say, geez, I'm glad I got to do that before I went and did those things with an actual sick person. Okay. Clinical placement. So this is something else that students are usually really interested in hearing about, talking about. Where can I be placed? You can be placed in a lot of different places. We have a very large geographic area, which I'll show you in a sec, but our placements occur in more than just hospitals. Most people think that hospitals are, where the majority of nurses work, and that's true, but there are so many other places that nurses work. Nurses work in the community, they work in long-term care, they work in public health, mental health, they work in primary care, the intercommunity health center. Nurses are everywhere. And so we try to place you in lots of different kinds of places to give you a sense of what is out there, and also a sense of what you might like, and maybe what you don't like as much. This is that geographic area I was talking about. It's really big. So this is the largest sort of, formerly known as the LIN region in the Southwest geographic area. And so all of our placements have to be confined to this geographic area. These other areas are sort of the territory of other schools, and we're really respectful of each other, and we don't step on each other's toes. So we keep our placements in our geographic area, but it is really big. So there's a lot of places that we can place students. The majority of our placements are close to home, but there are some really great placements that are a little bit further away. So because placements can be anywhere in this area, I want you to read this third bullet here that says students can expect to receive at least one placement outside of London. And often those placements are the placements that the students end up raving about the most, for lots of reasons that smaller hospitals, more autonomy for the nurses, lots of reasons, but you can expect to be out of town for at least one of your clinical placements. So just keep that in mind. And if we fast forward to you being done, you've graduated, you've made it through the program and you've graduated, now what? You're not a registered nurse when you graduate from our program. You just have a Bachelor of Science in Nursing. Now you need to become registered with the College of Nurses of Ontario. That's our governing body. And so graduates are eligible to write the NCLEX RN exam, which I'm sure you've heard of, after you've successfully graduated from our program. Our graduates historically do very, very well. We have extremely high pass rates on our NCLEX exams, both in our collaborative and in our CTF programs. And you can learn a little more about the CNO and what does it mean to be a governing body or to be registered with the CNO by going on their website there. Careers in nursing, this is not an exhaustive list. Obviously, there are so many places that nurses can work. And Denise and I usually, when we do this presentation together, we always try to take a minute to remind you to keep a really open mind when you come to the nursing program. Lots of you will come to the program with ideas, sometimes really, rigid ideas about what you do and don't want to do as a nurse, or what you do and don't like, and the kinds of placements you don't want and the kinds of placements that you do want. And that's okay, except that when you get here, I hope that you can find a way to let some of that go and really be open to all of the placements that you're assigned to, even if it's something that you think you don't like or that you're very unfamiliar with. You don't know what goes on there, or it makes you nervous or even a little bit afraid to go there. I think you'll find that, well, not only are maybe the placements that you didn't necessarily love, it's still valuable learning, right? To know that, and you're going to get something out of it. But the places that you think you're destined to work in maybe end up not being what you thought, and keeping your mind open to all of these other possibilities is going to create a really good and rich experience for you. Our placement coordinators make sure that you have a varied experience, that you don't keep getting the same type of placement over and over again. They're very careful to kind of spread the wealth a little bit and allow you to experience as many different things as possible. We obviously can't expose you to everything, but we can do our best to expose you to as much as possible, so that you can really get a sense of what's out there and what you might like and what you might be good at. I know when I came to, I don't know about Amy, but when I came to the program, I convinced myself, even though I had no idea what they do there, that I was going to be a labor and delivery nurse, darn it. And that was all I wanted. And I spent 3 shifts there and thought to myself, geez, I got to start over again. I don't want to work here. It just wasn't what I imagined. I wanted something different. Would I ever have imagined myself here giving this presentation to you? No, I wouldn't. Right? You keep that open mind, and nursing can take you in a lot of different directions. And it's important that you kind of give every opportunity I don't know, a fair shot, I guess. Ooh, and that's it, kind of an unceremonious end there. I'll stop sharing, and I'll thank you very much for listening to that presentation, and hand it back to Bryce.
Thank you very much, Jessica. That was fantastic. Okay, we're all set. We'll now transition into a mini lecture from Amy Horton, and this is going to be a little look at clinical judgment.
Hi, everyone. My name is Amy Horton, and I am full-time faculty here at Western University in the School of Nursing, and I'm also the co-associate director of the undergraduate BSCN program. I've been asked today to provide a lecture that would be reflective of something that is important within the nursing program here at Western University. And there are so many wonderful topics and concepts that we discuss in the program, so it was hard to pick just one. However, one of the concepts that is threaded throughout the program is that of clinical judgment, a topic very important to how we function as practicing nurses. So I thought I'd take this opportunity to introduce you to Tanner's clinical judgment model for the next few minutes. So there are many attributes that a nurse needs to possess in order to provide the best care possible to patients, but one of the most important concepts or development of these attributes is something called clinical judgment. This is a concept that will guide the majority of your learning at Western School of Nursing. So what is clinical judgment? The concept of clinical judgment in general refers to interpretations and inferences that influence action in clinical practice. In general, it is an iterative process of a few components such as noticing, interpreting, responding, and reflecting during clinical scenarios. Clinical judgment is a combination of gathering data through what we refer to as noticing, where we use the patient's history, our findings in our physical exam, to then interpret the data based on knowledge we have gained throughout our education or throughout our experience in our career. We use both of these things to then respond in patient situations to provide evidence-based, patient-centered care. Nursing education, as I said, is really rooted in the development of clinical judgment as depicted here in Tanner's clinical judgment model. As I've mentioned, this model is circular, so you generally start in noticing and move along throughout the actual model, but at any time you can go back if you feel as though you need more evidence, more things to notice, if you think you need to reinterpret something. It's interactive, it moves fluidly between and among all aspects of the process. In order to make clinical judgments, the nurse employs a deep understanding of individual patient situations, as well as the nurse's own background in terms of their own experience and their own values. In essence, what does the patient bring to the interaction, but equally as important, what does the nurse bring to the interaction, as patient care really is a collaborative process. If we actually look at the clinical judgment model, it starts with the process of noticing. So what does the nurse notice about the patient? This really requires taking a holistic view of the patient situation and a willingness to consider factors involved in all aspects of patient care rather than its own individual aspects. We then are able to move on to interpretation, which helps the nurse decide how to respond. At first, this process is rather analytic, meaning that knowledge as a beginner really relies on concrete theoretical knowledge that we've gained. But as we move further along in our ability to critically think as practitioners, we start to use more intuition, which helps us interpret patient scenarios when, like I said, we become more competent. Sometimes you'll hear me refer to this in class as using our spidey senses to interpret what's happening. Once we decide as nurses how we're going to respond and act, the nurse then needs to reflect on whether it was the correct thing to do. So we need to evaluate and reflect during the interaction. So for example, was the medication that we gave the patient, is it helping? Is it reducing pain? So we do that in the actual scenario. And then at other times we can reflect on action. So this is thinking after the fact, how can we improve, what went well, what didn't go well. And this is because nurses are lifelong learners and are constantly improving in practice throughout their entire career. So again, that's considered reflection on action. Also within this model is the concept or idea of what exists behind the patient, or sorry, behind the nurse's eyes. This includes things like the nurse's knowledge, which can be from theoretical sources that are now being applied in a practical sense, which is what you'll have the opportunity to do at Western. The more you learn, the more you will add to your ability to critically think like a nurse. It also, another concept behind the nurse's eyes are our past experiences. Have you as a nurse seen this patient situation before? What other experiences might the nurse use from their own life that will influence the interaction? There are ethical perspectives that are noted. So these are grounded in the difference between what is right and wrong. And then also very importantly, knowledge and noticing comes from knowing our patient. And this isn't in a personal sense, this is more in the sense of being able to pick up on changes. So if you're a nurse and you were in the room 15 minutes ago, your patient was sitting calmly, quietly, watching TV, and then you enter 15 minutes later and you notice they're sweating, they're agitated, they're moaning. You're able to pick up on something has changed. You're noticing a change in your patient. And as we know, nurses are generally the healthcare provider that spends the most time with the patient. So we are best suited to, quote unquote, know them the best and pick up on these subtle changes. So if we look specifically at noticing within Tanner's model, what does noticing actually mean? So you can see here that the definition incorporates concepts such as observation, paying favorable attention to, or appraising a situation. Other words that are similar to noticing are to note, to see, to be able to detect, or to spot. And as you can imagine, these are important aspects when working with clients. And I think it's important to point out that noticing just isn't about your visual cues. It's also what the nurse is hearing, smelling, what you might feel or palpate as well. So it really involves all of our senses as a practitioner. Conversely, here you can see that the antonyms of the word noticing, so overlooking, ignoring, disregarding. Obviously, those are not words that you want to associate with nursing care, as overlooking, ignoring, Disregarding aspects of nursing care can result in grave consequences in terms of patient safety and outcomes. So really noticing is one of our greatest skills as a practitioner, and we will use it to pick up on big changes or small things related to our patient and their environment. Examples could be we notice a change in our patient's body language, or we notice maybe not a change, just how it is that their body language is contributing to your understanding of them. Same as in facial expressions. Are they calm? Are they happy? Are they upset? How does that relate to what else you're seeing with your patient? Is there a lack of eye contact? What are their speech patterns like? Is it pressured? Is it quiet? Does it sound sad? You might enter the room and use the beeping of a machine as something that you notice. Again, using a different sense to notice something that might be happening with your patient. So subtle signs that may have otherwise go unnoticed are all part of your ability to notice as a nurse. So what do you notice? What do you notice in this slide here? What facilitates our noticing skills? There are lots of things that contribute to noticing. Other things that we haven't discussed yet are things like simple proximity to the subject matter, the lighting in the room. In this case, the dependence on electronics to appropriately show you this picture. It's also about, like I said, your own senses being fine-tuned. What is your ability to hear, smell, touch, visualize? Your perspective. So what do you focus on in this picture? What might you be missing? Are you able to look at things? Are you able to look at this picture in a different way? It can, perhaps you are using your intuition right now in the fact that I'm saying you should be looking at this picture. And so your intuition is saying, why am I showing you this picture? Do you get the sense that there must be something else in it that you should be noticing? And then, have you seen this picture before? And know that it's not simply a picture of a couple in what seems like a lake setting with a beautiful tree, but in fact that there's also a baby that's superimposed within that picture. Maybe now you can see that I've pointed it out. If you have seen it before, it's almost impossible not to notice. If you haven't seen it before, it's harder to pick up on. And again, that relates to experience. One of the exercises that I often will do in class to highlight how we notice things is to show this picture of the corner of Richmond and Dundas in London, Ontario, here where Western is situated. And I asked my class to spend a couple of minutes with the person beside them to try and think of 3 things. Try and uncover or decide through noticing 3 aspects of this picture. So I asked them to talk about what time of day they think it is, what day of the week they think it is, and what month of the year they think it is in this picture. And usually this is a very interactive process and we do a lot of talking amongst ourselves. I'm going to just talk to you a little bit about what generally we talk about in more of a didactic sense. So if we look at time, if we notice in this picture what time we think it is, well, it's pretty easy to see that there's a clock here and it says that it looks to be at about 10 to 12 or 11:50. We can probably surmise that it's AM because the sun is out, people are on the street, the lights are not on, doesn't appear, so this does seem to be during the daytime. So 11:50 AM. Can we know that for sure? Do we know that maybe the clock didn't stop or the battery ran out? Well, did you notice that there's another clock up here? And so we're able to use that as another piece of evidence to decide that yes, in fact, this is probably correct. It's 10 to 12 on whatever day of the week it is. If we look at the month of the year, many of my students will guess that it's fall or spring, and they guess this related on the shadows that are appearing in the picture. I was astounded by this at first. I never considered for a second that the shadows would add to my clinical reasoning. I don't know about what shadows look like in the spring or fall, so it really didn't add to my clinical reasoning. But for them, it helped them decide that no, when you see long shadows like this, it generally means, you know, in relation to the position of the sun, and that generally happens in the spring or fall. So again, past experience, past knowledge, really important to how we notice things. So we could take the shadows and see if there's any other clues that might tell us what month it is. So we could look at, for example, what are people wearing? It looks to me as though there's a combination of short sleeves, some lighter jackets. I don't see any hats, I don't see any mittens, I don't see any snowsuits. If it was particularly hot, I don't think people would be wearing jackets at all. So we can pretty much rule out that this is winter or summer, but it does appear to be fall or spring. Well, we're not really, that's not enough concrete evidence for me to say one or the other at this. So what else can I use? Usually, you know, we could look for trees. I don't see any trees, so I can't look at the leaves to say, you know, they appear to be budding or they appear to be changing color and falling. Usually at this point, someone will point out, well, look at this sign here. That sign says, welcome university students. When do we normally welcome university students? Generally in the fall. So that's another clue that helps us know perhaps this is more so in the fall time. Usually the students that notice this sign tend to be the ones sitting in the front. The people in the back usually don't detect it because they're further away and they aren't able to see it as well. So again, that proximity to your patient, to the subject matter, changes how you're able to notice something. So we might decide then, okay, it's 10 to 12 a.m. on a fall morning. What day of the week is it? This is a bit harder to land on. Whoops. Some students will guess that it's a weekend day. And they'll say that, well, that's because we have a child here. And if it was a child, the child should be in school. Okay, what knowledge do I have of this child? Are they school age? I can't really tell that. They're smaller. Maybe they're 3, 4, 5. Maybe they're not in school yet. Maybe the mom or parents homeschool and that they just don't go to school. So it's a helpful clue, but it doesn't really help me land on anything. Some people will say, some students will say, well, this is a really busy time at this corner. So, you know, busy times tend to be on weekdays when people are bustling and hustling to get to work. Reasonable. But if we look at some of the other clues in this picture, what year or decade do we think this is? Look at the cars, the cars, look at the black and white photo, look at the styles that they're wearing. This is in obviously a number of decades ago. Would women be hustling and bustling to go to work? Likely not. Some students will say that they think if it's not a weekday, well, maybe all of these people are on the corner because they're going to church. Again, what would we be wearing to church in this time period? Wouldn't there be more children, et cetera, et cetera? Is this store open? We can't really tell. We can't really use that as a clue. There's a man here. I can't tell if he's looking to go into the store or if he's looking through the window because it's closed on a Sunday. So there's all sorts of clues that you can put together to try and decide the time, the day, and the month. So what's the right answer, you ask? Well, I don't know. I'm not sure. And that brings us to another important aspect of critical thinking as a nurse. There are often multiple right answers, all of which can be plausible. As you can see in this slide, asking which of the 4 numbers doesn't belong. Well, you could say 43 is not the square root of something. You could say that 9 is out of place because 1 plus 6 is 7, 2 plus 5 is 7, 4 plus 3 is 7, so 9's the outlier. 16 is the only even number. 43 is the only number with a larger number in front than the other ones. As nurses, we have to think about all of these plausible answers and interpret them to the best of our ability in order to provide excellent patient care. At Western, we will spend our time together showing exactly that. How to do just that is critically think and use the evidence that you can gather to inform your critical thinking and your judgment. I hope you enjoyed that. I look forward to welcoming you to the School of Nursing at Western University and further discuss other important nursing concepts to help you in your career.
Thank you very much for that, Amy. That was fantastic. I love that deduction of the photograph on the corner of Dundas and Richmond there, and everything that could be kind of perceived in that photo and how it relates to patient care and nursing. So thank you very much for that lecture. Our attendees have now had a chance to learn a little bit more about nursing at Western, take part in a mini lecture, and now we want to know what you're looking forward to most when you start at Western. So Chris will go ahead and share that poll. Are you looking forward to choosing your courses and your program, maybe meeting new people? Some of you may be moving away from home maybe for the first time. Awesome. We've got a lot of folks saying all of the above. They're looking forward to all of those things. Wonderful. All right. For our next poll, we would like to know which one of these people is a Western alumni. Let's see how many get this one correct. We've got Marvel superhero Simu Liu, Canada's first female astronaut Roberta Bondar, blogger and TV star Lainey Liu, and DJ duo Loud Luxury. Awesome. I suppose I should have included an all of the above section for this because all four of these folks are proud Western alums. Very nice. And last question. We'd just like to know, have you decided if you'll be joining us at Western in September? Maybe you have, you're really excited. You're thinking about it, it's not official just yet, or maybe you're still waiting on a decision. As Jessica said earlier, a lot of those decisions are going to come a little bit later. So no worries if you haven't heard just yet. Awesome. Thank you so much for participating in those polls. And now a moment I'm sure you've all been waiting for. We'd like to welcome on some of our current nursing students for our student panel. So I'll welcome on Ira, Jack, and Kayla if you'd like to join me on screen here. Wonderful. Thank you so much for joining us. I guess we can get started with a couple introductions. So maybe we'll have Kayla start and then Jack and then Ira. If you can just tell us your name, where you're from, maybe what year you're in, and yeah, we'll get started with that.
Okay, so hi, I'm Kayla. My pronouns are she and her. I am in year 3. I am in the CTF program, so I'm just finishing up level 2 of the program, going into level 3 in May here. So I did complete my first 2 years of undergrad at Western as well in the medical science program before entering CTF in fall of 2021. So I did have a bit of a unique experience in comparison to the collaborative program. So if you have any CTF program specific questions, you can ask those away to me. But yeah, that's me. I'm from Brandon, Manitoba, so I am an out-of-province student as well. So any questions about being out of province, you can ask those to me as well.
Thank you very much, Kayla, and we'll have Jack go next.
Hello, I'm Jack. I go by the pronouns he and him. I'm in my second year of the collaborative program. I'm at the main Western site. So if you have any questions about that, I'm happy to answer. And I'm from the GTA, the Richmond Hill area.
Awesome. Thank you, Jack. And Ira.
Hi everyone, good evening. My name is Ira and I'm a current 3rd year nursing student. I love chatting with prospective nursing students, so I am very excited to be here today. A little bit about myself. I started at the Fanshawe site in my first 2 years of the program. I grew up here in London. I enjoy cooking, baking, playing piano, honestly, just having some downtime, going for walks, things like that. I'm also the current president of the WFNSA, so that's the Western Fanshawe Nursing Students Association. So that's what I like to do on my time off when I'm not doing school. And I genuinely enjoy and love being on council. So that's me.
Awesome. Thank you so much. Ira, you must have been reading my mind, because one of my first questions was going to be, what are some of the ways you have gotten involved on campus, clubs, sports, jobs? So if you'd like to start us off and maybe speak a little more about your experience there, we'd love to hear.
Sure, I can get us started with that one. So ways I'm involved on campus. So as I said, I'm the president of the WFNSA. I have been on council every year since I was in first year. So it's been a huge part of my life, my learning and growth as a nursing student. It can be a lot of work sometimes, but in summary, I support all of our council members in carrying out their events, initiatives, and just making sure everything's running smoothly. I communicate between the school, external organizations, and all nursing students. I also helped establish this past year the CBNA Western chapter. So this is the Canadian Black Nursing Students Alliance chapter at Western. I also organize free workshops for nursing students, like a free ECG reading course, medical sign language courses, and a perinatal workshop coming up soon. Aside from council, I'm also working as a clinical extern. So this is a new position that a lot of nursing students have started this past summer at the hospital. So I basically worked full-time all last summer right after my second year. So it'll be a year now that I've been an extern. And then I worked part-time during the school year. So that's my extracurriculars.
Wow, thank you so much, Ira. And Jack, Kayla, do you have anything that you'd like to add on there in terms of extracurriculars maybe you've been involved?
Yeah, so for me, so being in med-sci, I was in sciences before, so I VP for the UPaw, which is the undergraduate pathology club. So I was VP of communications and events this past year. So that's it's relating to nursing, but it's a little bit different. It is it's med-sci specific with the honor specialization. I still kind of rode that out because it was a bit of a last minute decision for me to switch to CTF. But with that, it was still really flexible. I took pathology with CTF. And then I also, these past years, I've been a mentor with the out of province Student Association at Western, mentoring students who come in from out of province. That's the Central Canada, being from Manitoba. And then I'm actually moving into the coordinator role for OPSA Central Canada next year. With that, being on campus, kind of moving that over. I also play intramural volleyball. I did that in my first year, kind of had to pass on the second year with COVID, but then obviously right back into it this year. They've brought it back. And then I also, I'm entering a nursing externship role this summer at Victoria Hospital. So I'm starting that on May 2nd. I'm going into the mother baby care unit. So I'm starting that. So I'll be working this summer on top of my CTF level 3, and then I'll be working also throughout school next year. So that's a unique role you get the opportunity to apply into once you start nursing if you're interested.
Thank you very, very much. And Jack, we'll pass it off to you.
Yeah, so I got involved with a lot of different types of clubs. I'll just mention a few I joined in first year. I joined like UNICEF, WIC, so that's like an investing club. I also joined the photography club. And in this year, I joined a bunch of different other clubs. So I joined CSA this year, where I'm the productions director for that team. I'm also a photography executive on the Kaiser Fashion Show team. So if you want to search them up, we just came out with our fashion magazine. So if you want to go take a look, we're all really proud of it. Just plugging that in. I'm also on the WFNSA, so I worked with Ira. In my first year, I wasn't on council, but I was part of some of these subcommittees that the WFNSA offers. This year, I'm Speaker of Council, and actually, I'm the President-elect for next year. So if you plan to join WFNSA, we'll be happy to see you. I'm also part of SNAPS this year. That's basically a nursing mentor sort of program that WFNSA offers. So yeah, there's lots of ways to get involved. I definitely encourage joining in clubs and just testing things out. Definitely gonna make your university experience.
Wow, thank you to all of you. It sounds like you're very busy, but involved in some very incredible things. What I'd like to know next is how, first of all, how would you recommend incoming students to get involved in maybe some of these things that you've been involved in? And also, how do you balance kind of that work-life balance if you've got a job, or also doing classes and intramurals and clubs and whatnot?
So for me, I definitely would recommend finding a few things, specifically like with clubs and all that, that you're genuinely interested in and enjoy doing, rather than just kind of finding a million things and spreading yourself too thin. A lot of people try to just join a bunch of things in first year that they think would look good on a resume, and just doing it just for the sake of doing it. If you find those few things that you really enjoy doing and kind of putting your all into it, if you are doing those, when you're applying for jobs and stuff, they'll see that you actually genuinely care about it, and they're just going to see right through those things too. Just kind of piling things on your resume. So just do things you enjoy doing, and it won't seem like work really. And you'll meet so many people that are like-minded, and you'll just get a really good community of people behind you with that.
Excellent advice there, Kayla. Thank you very much.
I'll just hop in here. I think Kayla definitely hit it on the head of the nail. So basically, I think you should really know your limits. So really reflect on what you know about yourself and what you're able to handle. So that's going to be different for everyone. So maybe one person can join, 3 clubs and be a-okay with, balancing it with schoolwork and everything. But other people, maybe not so much. So just know yourself, know your own limits and what you're capable of, and don't, overdo it, because, we want to take care of ourselves and protect our mental health. Also, I'm sure you guys already know, staying organized is going to be super important in university. And if you don't know that, you'll find out really soon. But using a calendar, having a to-do list, all really important.
Thank you very much, Jack. And Ira, do you want to finish off here?
Yeah, Jack and Kayla pretty much said what I was thinking. I'll just quickly add, I guess, at the start of every semester, I like to collect all of the syllabuses for each course and just mark down all of the deadlines and important assignment dates and exams and quizzes and things like that. So we know what the rest of the semester will look like, and what days you have free time, what days you need to focus on studying for an exam, what days you can work and things like that. So yeah, staying organized is key.
Wonderful. Excellent advice once again. Really quick, do you have a favorite spot on campus to study? And do you have a favorite spot on campus to eat? That's a question that we seem to get a lot. So any special spot that you've found that you like to study, and any special spot you found that you like to eat?
I can go first. My favorite place to study is Weldon Library. If you guys got to do like a campus tour, you might have visited the library, but yeah, they did renovations recently, so it looks really cool. But I just have a lot of fun memories with friends studying there. So that's why I just really like going back there during exam season. I'm sick right now, so I can't go, but I've been wishing I could be on campus studying at Weldon. But my favorite spot to eat, I love the Spoke. And I think if you ask anyone on campus, they would say the same. They're known for their bagels. And I guess I'll just plug in my bagel order here. I really love the jalapeno cheddar with herbs and garlic, I think it is, with cream cheese. So yeah, really good. If you get a chance to try, definitely do.
Thank you very much, Jack.
Another good spot is Somerville House to study in. That's like not usually super busy. And then I think it's it's either the International Affairs Building or I think it's the International Affairs Building. It's kind of like right behind. It's another good one. It's really pretty, lots of windows. And then I love the Taylor Library, but that's also from my my science days. And then I was gonna say Spoke as well. So he kind of already took that one from me.
Yes, a popular spot for sure. Thank you, Kayla. And Ira?
Yeah, we also got a newly renovated private study space just for nursing students and the Faculty of Health Science in the Health Sciences building. So it's newly renovated and it's a nice place to study. So I like going there as well. And I love eating at the Spoke and the Wave as well. They're close to Weldon, so it's a good place to eat.
Awesome. Thank you so much. A couple more questions here before we finish up. What has been your favorite nursing course that you've taken so far? And why, I should add.
I just said, be careful, Amy and Jessica are on this Zoom.
No pressure, no pressure. But yeah, if you've had a favorite course that you've taken here at Western, maybe why that is, or something interesting you learned in a course that has kind of stuck with you, we'd love to hear about that.
So I think probably my favorite lab I've done is my medication administration lab. I just finished that up in level 2, so this semester. It's just really hands-on. You learn a lot. You learn it really quick. You do 2 a week for 6 weeks. But yeah, it was really interesting. You get to do injections, and that's kind of, yeah, it's just fun. And then probably one of my all-time favorite classes I've taken at Western is it's actually was when I was in. I love I took med sci my first years. I love my sciences. It was micro-M 2500. It's intro to microbiology and immunology, and I took that, and I'm a big micro-M girl. And so that's probably one of my favorite classes. Would have been what my honors spec was if I continued with med sci, but it's probably one of my favorites to this day.
Thank you very much, Kayla. Jack, Ira, any thoughts on a favorite course?
Yeah, I agree with Kayla. I really enjoyed the micro course. I don't know if you guys took the same one with Amy, being in CTF. I think you did, but I really enjoyed that course. I really like writing essays. I took this when I was in 2nd year. So it's a 3rd year course, but I took it earlier. I really enjoy writing essays and researching more about global health issues. We did a few reflections, and I learned a lot about the inequities globally, and about tetanus and tuberculosis and how that affects different populations, and just learned a lot in that course, and writing a lot of reflections. And my second course that I liked was the lab and sim courses in 2nd year, just learning more about like head to toe assessments, system assessments, wound care, med-admin. It was a lot of information in 1 year, but I really enjoyed learning and practicing all of it in lab. It was a lot of prep work, but things that we need to know before going into the hospital. So I felt really prepared with that.
I didn't have to take the micro-M course for nursing because I took micro-M 2500, but that probably would have been one of my favorites if I did.
I'll just jump in now. So my favorite course, Ira mentioned it, but I really love the 2nd year sims and labs. So I'm in 2nd year right now. So I finished that last semester, and it was a lot of fun. I really loved it. I think it's one of the first times you kind of get put into a scenario where you have to be the nurse, and you're really just applying and drawing your knowledge from all those different courses that you've taken in 1st year, some of the theory courses that you take in 2nd year, and applying it into that scenario. And there's a lot of freedom and sort of problem solving that goes along with it. So you're not, told what to do. You're kind of figuring it out as you go. And I think that was just a really unique and really fun experience to learn. So yeah, I just really loved working with, the lab instructors, and also you get to work with your lab partners too. Just a lot of fun.
Thank you very much, Jack. So yeah, you know, you never know. Maybe you've had a favorite course so far, and your new favorite is on the way down the road. So thank you very much, everyone. We'll finish off last two questions here. The first one is, what made you choose to come to Western? So I know we have a few folks that came from a little bit further away, but what made you choose to come to Western?
For me personally, so one thing, Western's just really beautiful. I think the campus is just amazing, and just having class and going on campus to study, that's a bonus. But I think what really sold me was just the community that's present at Western. I think I would argue personally that Western has one of the best student communities, and you really see that when you come on campus, join clubs, and just talk to people. It's just so inviting and really warm, and you can really find your place no matter where you're from or what group you think you belong to or identify with. So yeah, it's just a really great place to be and to learn.
Thank you, Jack.
Yeah, so for me, I came from Manitoba, so I had only been to Ontario a few times. I never actually even toured Western before agreeing to come out. For me, I just knew Western has a really, really high academic standing. Really high academic standing, phenomenal programs. Again, I came into the medical science program. It's a really good program. It really prepares you for going into kind of graduate degrees, master's degrees, med school, if that's the route you want to take, writing your MCAT, stuff like that. So that's a really big reason, that program there. Again, it has a lot of options. Me ending up in the CTF program, really amazing flexibility with courses, degree options. It's just really amazing in that sense. And just the community. I just love how it's like a little city. Like I think the campus population is close to the population of my hometown. So it's just like a little community within the city of London, which I really like. So it's just, you kind of bleed purple, and it kind of, I was a magnet towards it. I was ready to kind of start exploring Canada, and I picked, it was like a really rash decision, but we just kind of went with it, and the ball got rolling, and here I am 3 years later. So kind of went with it.
Thank you very much, Kayla. And Ira?
Yeah, pretty much the same things that Jack and Kayla mentioned. I chose Western because I heard a lot of great things about the program. They have a great reputation, and it seemed like an environment that I could really learn and grow in. And they have a very strong, tight-knit community, it seems. And it's been a great experience so far.
Wonderful. Thank you very much. And last question. We possibly have, Amy, sorry, did you want to jump in?
Sorry, sorry. I know I'm not supposed to jump in here, but I just want to say that there's a reason why, Jessica and I 20 years later are still here, and Denise has been here for, I'm not even going to mention how long, and Michelle as well. It is that unbelievable community that Western provides you, and I literally would love to echo Jack's comments about the just gorgeousness of, I mean, you're not going to pick a university because it's gorgeous, but this university is gorgeous. I literally, in the dead of winter, volunteer to take people's exams across campus to have them sorted out, because it's just so beautiful to be on campus every single season. And it's just it's just so fun to be at Western. And that's literally why I'm still here many years later.
Thank you very much, Amy. Yes, that's I can echo that sentiment as well. Campus is gorgeous. I came here when I first started working in the fall, as the leaves were changing, and the buildings, just the entire campus setting is truly gorgeous. So last question for our student panelists. We might have some folks in the crowd tonight that are currently in high school. They're making that transition to university. So if you could go back, what advice would you give to your high school self as you make that jump, maybe from secondary school to post-secondary at university?
So I think my biggest one would be that you don't have to have it all figured out. In high school, I definitely was the one that had like it planned out. I think until I was probably 30 years old, like I was gonna like have my undergrad, I was gonna go to med school, I was gonna like I had everything sorted. I knew up until like the specialization I was gonna do after med school. And clearly that's not what I'm doing anymore. And like I couldn't be happier, honestly. I thought my world was falling apart when I was in second year, kind of questioning like, do I even want to be in med sci? Like, do I want to go to med school and like take all these years of school? Like, and the reason I switched is because I was shadowing a physician actually, and I realized it wasn't really the career I wanted. Like, I wasn't like he wasn't spending as much time with patients as much as I wanted to, and it just wasn't what I wanted. And so when I started questioning it, I was just so set on what I told myself I wanted in 11th and 12th grade. So just know that things change, and that's totally okay. When you're 17, you're not meant to know what you want. Even when you're 20, like you're not meant to know what you want. And it's totally okay to change. And Western has so many opportunities for you to change things over and over again. Like you can extend your degree, you can do a master's. The CTF program is an example in itself. I switched over in my undergrad degree, but like I have friends in the CTF program who have a master's in a totally different degree, and now they're going through for their CTF program. So just know that there's so many options, and you don't need to know what's going on, and changing your mind is totally okay, and the world's not falling apart if you're anything like me, even though it might feel that way.
Thank you very much, Kayla. We're glad you found a spot that you really love in CTF, and thank you again for being here with us tonight. Ira, if you want to jump in now.
Yeah, sure. So my advice would be to keep an open mind, whether it's learning to adapt to different methods of course delivery or your placements. Like Jessica touched upon earlier, there are so many opportunities for learning. And when you're so early on in your education, you really need to have that open mind and know that you still have a lot to learn and experience, even as new grads. So having a variety of placement experiences, even if it's not something that you ever imagined yourself to be in or something that you don't think you'll like, these experiences will all open so many doors for you. And also just go easy on yourself. Your grades might change from when you were in high school or whatever degree you're from before. And just know that your professors and the school are so supportive and want you to do well, and just take time for yourself and go easy on yourself.
Very good advice, Ira. Thank you very much for being here and offering that wisdom to everyone joining us tonight. And last but not least, Jack, if you want to finish off.
Sure. So I think what I really took away from my time at university so far, I would definitely tell myself not to be afraid and just to take risks. I think that's exactly what you're here at university to do, and there's really so many opportunities that you have to take a risk to get to. So that could be joining a club or applying for a position that you wanted to try but wasn't sure if it was going to be a fit. So you're never going to know if it's going to work out, or if you're interested in that area, or if you just trying new things and just exploring what you like, expanding your interests, figuring out yourself as well. University is not just about academics, it's also about learning more about yourself and who you are, what you value, that sort of thing. So I think, yeah, just don't be afraid to try new things and take risks.
Thank you very much, Jack. Yeah, I think that aligns perfectly with keeping an open mind, and exactly what kind of Ira and Kayla and Jessica earlier was saying is just, you don't need to have it all figured out. This is a great time to try new things and learn more about yourself. So thank you so much to our student panelists, Ira, Jack, and Kayla. I know this is a very, very busy time for all of you, so we really appreciate you taking some time out of your schedule to be with us tonight and to share some of your experiences at Western. So thank you kindly. And we're getting close to the end of the night here. And I know we've had some questions coming into the Q&A box. So I'm just going to jump in there now, and I'll invite the rest of our panelists on to maybe tackle one or two of these questions before we close up for the night. So one question I was seeing pop up every so often was regarding placements. So maybe if we could talk a little bit more about when placements occur, maybe how long each placement roughly is, and how many placements someone might do in the collaborative program.
So I will try and tackle this one. And I want to say that we're in a bit of a transition in terms of our placement model. And this is because of a number of things that nursing is globally and locally right now in a crisis in terms of placements. And that's multifaceted, but and the healthcare system is changing, and one of the things that we really hang our hat on at Western University is making sure that we're responsive to healthcare system changes. And we work very, very closely with our practice partners to ensure that it's a reciprocal situation. Our practice partners do a huge amount of employing of our nursing students. So not just because of that, but we just try and be responsive to the healthcare system. We are looking at a model in years 3 and 4 that is going to be a very immersive experience. And I've said this a number of times in a number of different meetings, and some of you might not understand. Maybe some of you are swimming instructors, maybe some of you are parents that have seen your kids in swimming. You take your kids to swimming lessons, they have 5 minutes of really immersive instruction, and the rest of the kids in the class are hanging on to the side of the pool trying not to drown. And so we're trying to change that model to make it a one-on-one model where they are immersed with their preceptor, where they are immersed in the culture of the environment, and they will learn much, much more. Because of doing that, and because of changing what that will look like in terms of people rotating through those hours, the best flexibility for our students in years 3 and 4 are going to be to have theory classes online and all of our important practice courses face-to-face. So it's a hybrid model in years 3 and 4. Which is the best way that I can explain it. And I'm happy to answer more questions about that if that's not clear.
I think that's fantastic, Amy. Thank you very much. Yeah, awesome that you can have that hands-on experience with some of that, the lab work and whatnot. So thank you very much. One other question I saw that came up was asking about any ways to get involved in research. And if there's anything available for students in the nursing programs at Western.
Sorry, I'll take this one as well. So this is, I love, and I think I responded to this person directly, but I love this question, and I love that our undergraduates are looking at research opportunities. And one of the things that we haven't talked about is the pathway that we can create into our graduate programs. We have fabulous graduate programs. We have a Master of Nursing Leadership program. We have our traditional Master of Science in Nursing thesis program, PhD, and we also have our nurse practitioner program. And we really try and promote going into those programs. If you are a student that's interested in research in an undergraduate situation, generally speaking, those students self-identify. They come forward to any of the professors within the program, and we link them to our graduate chair of nursing, and they will work with the student to find a mentor in an area that they're interested in, and they can get involved in research in that regard. So absolutely, it's a possibility. but students need to kind of come forward to say, I want to do this, and we find you the opportunities.
Fantastic. Yeah. So sounds like there's some great opportunities for research there. And my last and final question was going to be about maybe some graduate programs, but you covered that as well, Amy. So thank you very much. Great to know that there's many opportunities beyond that, those undergraduate programs.
Yeah, I'll just mention, so our MN Leadership program is a basically online program, which is very attractive to nurses who have graduated, who are RNs and are working. And so it provides them great opportunity and flexibility. There are some sort of residency times where they come together as a group and work together, but generally speaking, it really provides some great flexibility. And by leadership, I don't mean getting you prepared for managerial jobs. I mean, how can you be a leader in nursing in multiple ways? The thesis-based programs, the master's, the PhD program, we have a robust program with multiple areas of interest. And then there's the nurse practitioner program, which is a more clinically focused program that prepares you for an expanded role or scope of practice in nursing, which I'm a nurse practitioner. So if anyone has questions about that, I'm happy to answer.
Thank you very much, Amy. A friend of mine actually just started her time in the nurse practitioner program. She worked as a nurse for a few years and then decided to come back to school and continue with that program. So thank you very much for shedding some light on those graduate programs. And I think we're right at 8:30 here. So I want to finish off by saying a huge thank you to all of our volunteers for making this event possible. As I mentioned, a very busy time of year for many of us, but we greatly appreciate you carving some time out of your schedules. And of course, thank you very much to all of our attendees. We appreciate you joining us this evening. We hope that you got all the information you need. But if something comes up later on, you can always find ways to connect with us at welcome.uwo.ca. Western, both the university as a whole, as well as the nursing programs, have tons of information on their websites. So definitely check those out. And there are ways to connect with us on both of those websites as well. So with that, I will sign off. I wish you the best of luck on your journey to university. And thank you again for joining us tonight. Take care, everybody.